Hello, my name is Dr. Harpreet Singh Kochar. I am consultant ENT and director at CRH ENT MRI and Diagnostics, Greater Noida. This is a specialized ear, nose, throat surgery center located in the heart of NCR, and we are the only specialized ENT center in National Capital Region.
So, doctor, what symptoms suggest a child may have chronic tonsillitis or enlarged adenoids?
Enlarged adenoids in children can present with problems like nasal blockage, frequent upper respiratory infection like persistent nasal discharge or recurrent nasal discharge. They would have difficulty in sleeping in the night, which will cause them to snore a lot. And sometimes, because of obstructive symptoms, it may develop a phenomena called sleep disordered breathing, in which the child sometimes hold their breath while breathing in the night. This leads to excessive lethargy and lack of energy in the day, uh, or on the opposite, they may become very hyperactive. The problem with tonsillitis is slightly different. Tonsillitis can cause problems both with infection as well as enlarged size. With infection, it will cause fever, throat pain, and enlarged glands on the neck, which are sometimes felt by palpating the neck. And the size enlargement will cause difficulty in breathing in the night, snoring, and obstructed breathing during sleep, leading to sleep disordered breathing.
So, how do these conditions affect sleep, speech, or general behavior in kids?
As I mentioned, that because of the enlarged adenoids in tonsils, the breathing space can become obstructed. So, if the breathing space becomes obstructed while the child is sleeping in the night, when the airway becomes slightly reduced in tone, it tends to collapse on its own. And when the collapse is there, then during inspiration, the child will have obstructed breathing. This will cause lack of proper sleep in the night, which will lead to excessive letharginess, and it translates to poor work performance. For example, in children, it will lead to poor grades in school, lack of concentration, and sometimes this also affects the ear, leading to reduced hearing and damage to the eardrums.
So my next question is: at what point do you recommend tonsil or adenoid removal?
So first of all, based upon the symptoms for adenoids, when we see that the child is not responding to medical therapy, the symptoms are pretty severe, leading to severe blockage and severe sleep issues. And there is a persistent discharge leading to facial deformity, causing adenoid faces and improper dentition because the teeth get malaligned, the jaw growth becomes disrupted. So one is that, and the child does not respond to medical therapy, which we will discuss. So these are the conditions where we suggest that adenoid should be removed. For tonsils, see, tonsillar infection in children is a common thing, and they can have about 4 or 5 bouts of tonsillitis in a year. If the frequency of infections in tonsil crosses that, say, more than 6 times in a year for the last 2 consecutive years, then we would suggest that tonsils need to be removed.
So, apart from that, are there any non-surgical treatment options that work very well in early stages?
For adenoids, yes, there are inhaled corticosteroid sprays because in few patients in adenoid, the basis of the problem is inflammation because of allergy or infections. And in those cases, some nasal spray, steroid-based nasal spray can take effect. The reported rate of improvement with steroid sprays is somewhere around 10 to 20%, but in my experience, it doesn't work in more than 5% of people. In tonsillitis, sadly, there is no medical management which can improve the rate of infections or the size of the tonsils. So if that is there, then we would have to resort to surgery after a while.
So lastly, can adults also suffer from enlarged tonsils or adenoids?
Yes, that is a good question. So in adults, adenoids is not a problem. Conversely, if an adult presents with adenoid hypertrophy, then our first suspicion is that this could be a tumor. So we have to take a biopsy. So adenoids is not a possibility in adults. By adult, I mean above the age of 30-35 years. But we've seen children progressing into adulthood, for example, at the age of 20 or 25 years. And in these people, we have seen adenoid to be persistent and we have had to remove them. So once they are present in children, that can progress into adulthood. But de novo, they won't start in adulthood. And yes, tonsils can be there in adults. So they can both be obstructive or non-obstructive. So we may need to remove them if they are obstructive in size. and we may need to remove them if there is frequent tonsillar inflammation in adults, but the rate of infection in adult which will guide us to remove is slightly less than in children. So in adult, a rate of about 3 per year for the last 2 consecutive years. That is when we decide whether tonsillitis, a tonsillectomy has to be done or not.